The GV Public Health Unit is evolving. From our roots in COVID-19 response to now, we have emerged from the pandemic as a fully operational public health unit, which continues to grow. We are one of 9 public health units across metropolitan and regional Victoria, funded by the Victorian Department of Health, and we represent 7 local government areas across regional northern Victoria. The GVPHU is governed by Goulburn Valley Health and focuses on 5 key areas of work: health protection, health intelligence systems and digital innovation, public health integrated planning, promotion and programs, engagement, communications and capacity development, emergency management. We will work together with our communities to foster partnerships through collaboration and engagement that facilitates equitable, accessible health prevention, service provision and information that empowers people to optimise their individual well-being and drive better health outcomes for regional people in northern Victoria.
Goulburn Valley Public Health Unit began as a COVID-19 response in the pandemic. We were involved in contact tracing, outbreak management, vaccination and testing. Our remit has expanded in the last 6 months. We're now responsible for health protection, health promotion, COVID outbreak management, as well as communicable disease outbreak management and infection prevention control advice. The Public Health Unit's communication and engagement arm is responsible for ensuring there is timely, accurate and inclusive information to all of our community. Our community spans multiple different languages, multiple different community organisations, as well as multiple different communities from both Australian and overseas. So success for the Goulburn Valley Public Health Unit is utilising evidence-based data that is locally informed through collaboration and partnership that is specific to our region to ensure that any project that we do commence and complete is tailored to our specific catchment.
What is now the CCOM team was originally stood up to respond to the COVID-19 pandemic and was involved in contact tracing and outbreak management across the Goulburn Valley region. Our remit has expanded into other notifiable conditions for which we manage cases, contacts and/or outbreaks, depending on the condition and the public health actions required. Our overall aim is to protect the health of the community through comprehensive public health follow-up to prevent the transmission of communicable disease. The data that we collect, dependent on the condition, is also used by our analytics and epidemiology team for local surveillance, as well as feeding into statewide reports. The future of the health protection team is primarily focused on the transition of notifiable conditions from the Department of Health to the LPHUs. The current plan is to have all but 3 of the 80 notifiable conditions in Victoria fall within our remit for management and follow-up.
We work hard at developing an in-depth understanding of the health and well-being of the people in our region, working in close collaboration with partner organisations and our community as a whole to advocate for priority populations, drive community awareness of public health issues to inform and produce high-quality evidence-based public health interventions.
The relationship is critical and fundamental, particularly in a place like Shepparton. We've got a demographic profile unique for a provincial Australian city, and this is where the relationship with the local public health unit was beneficial, in that we were able to get over that hurdle of information in first language and provide it in a format. Now that's a relationship going forward that's going to be critical to both organisations. We always believe that coming into COVID that someone's language skills shouldn't prevent them getting access to information and services. And the local public health unit were instrumental in providing us with information in a format that was easily translatable and circulated throughout communities. That was a great boost to our relationship. Probably the best example of the relationship would be we provided bilingual workers at the Regional Vaccination Centre, and they were able to assist people, encourage them to get their vaccinations, support them on the day, provide interpreting if necessary, and the success of that probably reflected in the overall vaccination rates in our target communities.
So I've had a lengthy working relationship with the Public Health Unit extending back to the pandemic to make sure that we could screen, community test and provide vaccinations. So it was really important to work collaboratively on that to reach a whole population with the First Nations people. And that then extend through to the current works that we're doing now. Within Rumballara, we have family services, health and wellbeing, aged care and disability, housing. So to collaborate that from a public health response has been an excitement opportunity for Rumballara to build that, and we're looking for that growth and opportunity in the forward, and to really have a great impact on closing the gap for our community. It's really important that that First Nations lens and data and our health profile is impacted more broadly, to then see how that will transition to the life cycle of our community. The uniqueness of Rumballara, more particularly, is we work from birth to the dream time, so it's important that we have that population and public health lens to that as well.
Yeah, we've had a great experience working with the public health unit here in the Goulburn Valley. We've currently just finished working with them around promoting mosquito-borne diseases and how to best treat them, how they come about, and just how much damage mosquitoes have. This project was really awesome to work with the team on because it was specific to seasonal workers and temporary workers who currently work in open spaces. Collaboration is important in being able to get our community to get the best information and the most accurate information about health out there. You know, being able to receive that information in language, be able to see the people who can actually support them locally has been really important to them being able to take care of themselves locally while they're working away from their homes.
We're still growing and evolving as we take on new roles to protect our community from environmental threats and new emerging communicable diseases. The next few years we really hope to consolidate on our relationships with our local partners as we all work towards building the health and wellbeing of our community.
Feel free to reach out for the latest public health information, and we are always welcoming organisations and community services looking to partner and engage with the PHU in the interests of driving better health outcomes for regional people in the Goulburn Valley catchment.